everyone. Thank you for tuning in to this News Now Health Update with Lisa Gibalerio from the Wayside Youth and Family Support Network and coordinator of the Belmont Wellness Coalition. Good to have you back, Lisa.
Thank you, Joanna. Great to be here.
Well, today we're going to be discussing a serious topic, and that is sexual assault. Let's start with some basic data. How common is sexual assault among teens?
Too common. The CDC reports that about 1 in 5 teens report having been sexually assaulted.
And do you know the rates in Belmont, Lisa?
I do. The 2025 Youth Risk Behavior Survey tells us that in the past year, 7% of high schoolers who are dating, and that's about 32 kids, report having experienced sexual violence.
So then help us understand, what is the first thing parents should do upon learning that their child has been sexually assaulted?
The very first thing is to contact the Boston Area Rape Crisis Center, BARC for short. I think the number is right there on the screen. BARC is excellent at advising families on the next steps that they will need to take, including how and if to report the assault to the local police department.
So BARC will help provide a roadmap for what happens next. And I'm also wondering, what's the advice for what to say to your child?
Yeah, I mean, that's a great question. This is obviously an emotional situation for both the youth as well as those who love them. But the advice is to thank them for coming to you, for having the courage to share this. Tell them you believe them. Tell them that it took a lot of courage for them to come forth. Let them know that you care about them, that you are going to be there to support them and help them through this. You can talk about that you will be contacting the Boston Area Rape Crisis Center to get their advice on what to do next, that there may be an investigative process, that we may be going to the local police. We'll see, tell them we'll see what BARC advises. And just again, emphasize that you are there to love and support them through this very painful experience.
That's useful, Lisa. So what's the advice for what not to say?
Not to ask too many questions. Do not pepper them with, the who, the what, the where, the why. Let the professionals handle that part. Don't express doubt to your teen, to your child, and don't promise that you won't tell anyone else. It's more than likely that you will, in fact, be sharing this, at least with the Boston Area Rape Crisis Center and maybe with the local police department. So I would say, again, let the experts navigate all of those next steps.
Okay. And is there anything parents can do to help reduce the risk of sexual assaults happening?
Yes, and it's important to say that there is absolutely no way to eliminate the possibility of an assault, but there are some strategies that may reduce the risk. However, and I want to emphasize this, someone could practice all of these strategies and an assault could still happen. And if someone does engage in, risky behavior, they never deserve to be assaulted. The person at fault is the perpetrator, not the victim, not the survivor. So with all of that said, I would encourage parents to have conversations with their kids about how to look out for friends. Let them know that there is safety in numbers, to be aware of their environment, whether they're at a house party, if they're at a game somewhere, if they're out in town, be aware of what's happening around them. Discuss certain risk factors, discuss the effect of too much of a substance might have on a person. And again, know that even when everything is done right, assaults still occur.
Okay. That's very helpful information, Lisa. Is there anything else you'd like to add?
Oh, just that I forgot to mention that parents should talk about, keeping beverages, keeping drinks, even if they have a cup of water, keeping their drinks in their sight line so that nobody tampers with them. That's important. And again, this is difficult to say, but I would have conversations with your kids about the fact that Statistically speaking, sexual assault happens more often with someone they know, with a known entity, than it does with a total stranger.
Thank you, Lisa. This is definitely not an easy topic, but one that is very important.
Thank you, Joanna.
You've been watching a News Now Health Update. Until next time.